North-South Metro, I want to talk about that a little. Downtown,
And E&A.
oh yeah, I'm going to update you on E&A. Sorry. Okay. So, with regard to COVID, not a lot of change in the last few days. We, one spot of good news is that we have 249 people in the hospital right now, confirmed cases. That is down, it's down 10 from yesterday. So that is down a little bit, and that's good. We still have 71 people though in ICU, and that's been, it's been really mostly right about 75, so it's down a few. With 41 people though still on ventilators, that's been a pretty steady number. We had 37 patients admitted to the hospital, 59 discharged. So that's good, and of course you can see that's what has caused the number of hospitalizations to go down. So, but still pretty stubborn numbers, pretty much of a plateau. When we look at it on a graph, we see just a tad of a downturn. So those are our COVID numbers. We are hoping that with some of the new measures that have been put in place with regard to bars and restaurants closing at 11 o'clock, with regards to large venues going to 50% capacity, and now with Illinois going to also closing their bars and restaurants at 11 o'clock. St. Louis County's already closed, they close at 10. But we're hoping that we're going to see some effect from that pretty soon. We do still see that still the highest number of cases is people in their 20s. That age group is the highest, and then people in their 30s is the second highest. So we're still seeing that, and that has not turned around for us yet. One of the things that we are seeing is that the length of time that it's taking to get tests back is running a little bit better. We still have a few. Yesterday, for example, we had 3 cases that looks like they were over 2 weeks old. 3 of the 41 cases were over 2 weeks old, but the rest of them were right in the 7-8 day range. The average was about 4 days. So that's what we are. That's what we're seeing there. So not a lot of new news on the numbers front of COVID. I did mention on Monday that what we have seen here is a real uptick in the number of cases in South St. Louis, particularly 63116, which this is a 14-day rolling average, but not average, 14-day period of time, so that's changed by a couple days. 90, 91, 44 in 63109, 44 in 63104, 47 in 63118. So continuing to see that situation. One of the things I want to mention, yesterday on the pandemic task force call, the task force is focusing on, beginning to focus on, think about the flu. And the flu, of course, is another respiratory illness, and it won't be too long. It'll be probably a few weeks until people can begin getting the flu vaccine. And it's going to be more important than ever to get the flu vaccine this year because the flu and COVID symptomatically are somewhat close, and so certainly you don't want to get the flu and COVID. And this mask wearing and hand washing and social distancing, though, should also help a bit with tamping down the spread of the flu. They're seeing that in some other countries, and south of the equator, where they've been through this flu season already. So that's that's important. Be sure to get your flu vaccine. You know, we don't have a vaccine yet for COVID, but it's going to be really important for all of us to continue to stay as healthy as possible, because we don't want to infect one another. All right, that is COVID. With regard to north-south transportation, you may have seen yesterday, we posted this on social media and put out a press release, that the city has issued an RFP for a study. And I know some of you are rolling your eyes saying, oh, another study. But we really need to rethink this, because 5 years ago or so, there was a study about the expansion of Metrolink to a north-south route. That study said that the Metrolink expansion would cost close to $1 billion, 900 and some million, and that it would cost $24 million a year to operate. Now the city, voters 4 years ago, I guess about 4 years ago, 3 to 4 years ago, passed a half-cent sales tax, of which 60%, or about $12 million a year, goes into a savings account, if you will, for the local match portion of north-south expansion. And what's making us look at this again is to say, how will we ever accumulate enough money to both meet the local match portion of a close to $1 billion project, and then have the $24 million a year, probably more by the time it's built, $24 million a year to operate it? And so what we're looking at, asking the consultants to look at here, is what's the viability of using those funds, perhaps for another method of transportation, because we know that public transportation is really important to people, and we don't want to sit on this money. We want to try to figure out, well, what can we do in order to provide better transportation for people. We don't know the answers to that yet. That's the reason for this study, but we expect to have, we'll award the contract, and it'll take a while for this to get done. But there are a number of people that are that think an idea called BRT, bus rapid transit, which is not just a bus. It's a bus in a dedicated lane with dedicated stops. That is a high end. I think what we said in the RFP was a gold standard, and so that's one of the things that we want to look at. So that's been in the news in the last day or two, and I just wanted to bring that to your attention. Now, the Board of Estimate and Apportionment, we just finished that up maybe 20-30 minutes ago, and we did a couple of things that I think we should all be proud of. One, and I told you that we were doing this, the Board of E&A passed an additional $2 million to go into rental assistance, rental and mortgage assistance. Let me give you a little update on that. As you know, we had already allocated $5.4 million through the CARES Act. To date, we've received 6,500 applications. Now, about a third of those applications were not from the city of St. Louis. They were from St. Louis County or other jurisdictions, and we're referring those applications over to them. But we still have about 4,200 applications that are from the city, and provided all the documentation is available, will be eligible for mortgage or rental assistance. We're working with about 15 local agencies, providers, United Way, Employment Connection, Catholic Charities, in order to help mediate these amounts, and then whatever's decided on, pay that directly to the landlords. Excuse me. A priority is being given to folks that are already in the eviction pipeline, and it's limited to $3,500 a household, and hopefully won't even be that much in many cases. So that's the first thing E&A did that I want to bring to your attention. They allocated that $2 million. Second thing that E&A did, excuse me 1 minute. Too much talking. Second thing that ENA did was allocated close to $900,000 to the federally qualified health centers for them to be able to implement telehealth so that not everybody can get to the federally qualified health centers. And this will be an opportunity for people to see their doctor via telehealth. So I think that's an important thing. What have I got? Lastly, excuse me. Lastly, we talked on Monday about the, I'll call it the chaos, the traffic chaos in downtown. Bad behavior, people driving fast, people racing, people doing donuts on parking lots. And so one of the things that you're going to see in downtown beginning Thursday evening, Thursday, Friday, Saturday, Sunday, there will be sections of some streets that will be closed. There will be other streets, major thoroughfares that may be narrowed down in order to prevent some of this speeding. You will see additional law enforcement. You probably see a couple of tow trucks. And so we hope that we're able to really curb and reduce and make it a lot less fun for this bad behavior that has been going on. We are also taking some actions with some surface parking lots because folks have been going onto those lots. The surface parking lots, when they're not in operation, need to be secured. They need to be closed off. Need to have a gate so that folks aren't able to just go on the lot and do donuts and squeal their tires and burn rubber and all that, which I'm sure must be fun, but it's way too dangerous. So those are the four things that really I wanted to talk about today, and then we'll take your questions.
Few questions, Mayor. Starting on the topic of COVID, Lindy, who is watching, asked about the zip code 63109 and kind of wants to know if the health department thinks that perhaps some restaurants, maybe on like Hampton Avenue or social gathering in that area, could be to blame.
So, Lindy, that's interesting. I don't think they are to blame. What I spoke last evening with Dr. Eccles about, well, are there any clusters of this? Is it a nursing home? Is it a congregate care facility? And he said no, that really what we are seeing is that COVID is being spread among families and it's being spread among neighbors. And so I don't think that, I guess that could have something to do with the restaurant, but somebody gets it and it's spreading among those families and it's spreading among neighbors. And so you're seeing a few clusters like that. And those are the people that, of course, we want to be around, but it's just very contagious. So that's what we're seeing.
Kyle's question related to rental and mortgage assistance. Does the city anticipate that now $7.4 million is going to be enough to help the people who've applied?
Kyle, I think you can always use more money. We've got to use this money very judiciously. We're trying to keep people in their homes, trying to keep people from being evicted. We continue to wait on Congress to do something with regard to federal unemployment assistance, which has not happened yet. And we are also beginning to see more and more people be laid off. Some people were furloughed or their hours were cut, but now some of them are actually being laid off. So we could always use more money. We've got to use this money very judiciously. And, no, it's probably not enough, but it's what we've got. The other thing that we did today, I didn't mention this at ENA, we did allocate $200,000 for the circuit courts to be able to use for ankle bracelets or electronic monitoring, I should say, in order to keep people not in jail. So but still under monitoring.
On downtown, Mayor, Quita's question is, how does one report reckless driving and street racing, and who should they be getting a hold of?
Really, 911 is the, that's the only response that we can get to that. I think what you'll see this weekend and subsequent weekends, of course, as you will see, there's more enforcement and there'll be some street closures. Now, there's reckless driving, on any street. If you're gonna call in to 911, have a license plate or something like that. It's hard for the police to respond if somebody just says, hey, there's a blue car that just went really fast down Kings Highway. But 911 is really the way you have to report that.
So we got a question from Tanner, Mayor, about some of the surface parking lots, closing them in the short term, but what are some things the city is doing, has done, or can do to hold those private owners accountable in their properties?
So, we can revoke their permit to operate those lots. That's not what we want to do. First of all, we know that there are people who use those surface lots. They might live next door, or they live nearby, or they work next door or nearby. So we want those surface lots to be able to operate. But what our rules are, and this has actually been around since 2011, so darn near 10 years, is that when those lots are not operating, so at night after everybody, those lots have to be secured. That means a gate has to go down, or in some way those lots have to be secured. And I know that, now is a very tough time for these owners because there aren't as many people, people aren't coming down for ball games, they're not paying to park as much, but it's really creating a real problem to be able to have those spaces where the cars are, the drivers of the cars are misbehaving.
Question about the rental mortgage from Chris. Where is the additional money for the assistance coming from?
It's coming from the CARES Act funds, Chris. When we originally allocated the CARES Act funds, we allocated all but about 4 to 5 million. So we left some contingency there, less than 10% of the amount that we were allocating. But we left some contingency to see, where we would need more. We didn't allocate it all on day one.
Vicky's question, Mayor, on Southside COVID cases.
Mm-hmm.
You talked about a surge down there. Can you provide some of the actual numbers of the increases for those zip codes you've talked about?
So, Vicki, it's not increases. And this is on our website, right, Kyle?
Mm-hmm.
Okay, I thought so. So this is on the city's website. Just go right to the homepage, stlouiscity.gov or stlouis-mo.gov. There we go. And you can look at this map. And this one is for the period from the 5th of August to the 18th. So that's the 14 days. And it just shows you the cumulative totals by zip code. So, for example, cumulative would be since we started. 63116 has had 772 cases. In the last 14, it has had 91 of those cases. It's a densely populated area. 63118 has had 47 cases in the last 14 days and 472 in total. All this is available on our website, but I don't know what zip code you're in if you're interested in a particular one, but they're all available. They're all on the website, and there's a map. Today's map looks like this. The darker blue it is, the more cases there are in that zip code. So check it out on the website.
And then finally, how do you report bars, restaurants who are non-compliant with some of the COVID-19 orders?
So 622-4800 is the phone number to call for Citizen Service Bureau, or you can tweet it to @STLCSB, or you can go on our website and there's a spot that says make a complaint. Click on that spot. You can complain there about anything, from your trash didn't get picked up to, there's a spot there, and you can describe the restaurant we need the name, we really need the address or pretty darn close to it. At least 100 block and what street it is. And be as specific as you can, because what will happen is one of our inspectors will go there next day or the day after and see if they still observe the same thing and talk to the management about it, try to give them education if they need it, and try to bring them around. So.
Okay, Lyde, one more question from Lashana.
Only one more? Okay.
You previously talked about how we did not get as much CARES Act money as you thought we should have. So her question is, did we ever get more allocation from the state of Missouri?
Lashana, we did not. We haven't given up on it. But, had we been, when Congress passed the CARES Act, they said counties over 500,000 people would get the money directly from the federal government. So St. Louis County got about $175 million, or about $175 dollars per person, directly from the federal government. The other counties, the federal government sent it to the state, and then the state was allocating it back, and they were, I would say, supposed to, or it was recommended that they allocate back 45% of what they got to counties. The state of Missouri allocated 25% back. So what that means is that the city of St. Louis got about $116 a person. So we got, St. Louis County got 50% more than we got. Let's say it in that way. And we're still in conversations with the governor's office about that. And the difference was $17 million. So.
That's it for today, Mayor.
That's it. Thank you all. Thanks for hanging in there. I know we're a little late today, but we expect to come back and talk with you again on Friday. And thanks so much. Appreciate you being with us.